An Sky airliner containing medical supplies lands at the Freetown International Airport in Lungi on Sunday, November 7. The package is part of 6.6 tons of medical supplies airlifted by the World Health Organization in response to last week's fuel tanker explosion in the Sierra Leonean capital Freetown. The supplies, the first batch of which arrived 2 days after the incident, are meant to boost the government's response to the emergency it occasioned.
Today, we are handing over 1 metric ton of medical supplies comprising some drugs that include antibiotics, analgesics. We also have dressings for wounds. We have IV fluids. We have sterilizers. We have disinfectants. We also have gloves and body bags.
Officials say the supplies are enough to treat up to 600 people with severe burns. The tanker explosion, which occurred on Friday, November 5, in the Wellington suburb of the eastern part of the capital city, has claimed over 100 lives, with about 90 others hospitalized after sustaining injuries. Health authorities say some of those hospitalized have serious injuries that require specialist care, hence the need for foreign aid in both medical equipment and expertise. Minister of Health Dr. Austin Demby joined the WHO country representative Dr. Stephen Shongwe at the airport in Lungi to receive the supplies.
It's different when you see pictures in the media and you hear stories in the media. But when you go to the hospital and see our brothers and sisters with 70%, 80% burns, it's very heart-wrenching. We know that the first 24, 48, 72 hours of a burn victim is perhaps the most critical. And so, in seeking help and seeking assistance, even as we put our best medical foot forward, we look to partners. This is a very difficult occasion for all of us. Sierra Leone is mourning. Thursday of last week, nobody thought that we'll be dealing with this kind of thing today. A lot of hospitals, a lot of clinics are designed to manage 1, 2 emergency incidents, maybe 3, 4, or maybe 10. But to have a situation where you have over 90 people died within a short period of time, to have over 90 people hospitalized in various stages of illness.
According to officials at the WHO country office, the life-saving commodities were mobilized within 24 hours of the UN Health Agency receiving a request from the Sierra Leonean authorities. In addition to the medical supplies, WHO is also mobilizing specialist doctors to be deployed in the country to help the local experts deal with the cases. Expertise needed include plastic surgeons, physiotherapists, and clinical dietitians. The first batch of these specialist doctors were expected to arrive in the country by the middle of the week. The UN Health Agency is also supporting Sierra Leone through coordination and providing expert advice in the response efforts. Officials say the agency has also provided initial funds from its contingency funds for emergencies to facilitate the response on the ground.
Just the initial response to the tragic incident of Friday, and we are ready to provide additional support to the government, and then we'll see what else is needed. But as I said, we're working with other partners, and we recognize MSF, we recognize all the other partners that are supporting
Sierra Leone, they're supporting the country in this very, very unfortunate, tragic situation.
According to various witness accounts, the incident occurred when a truck loaded with stones hit the fuel tanker, leading to a leakage of the fuel. Residents of the area, which is located in an industrial estate, rushed to the scene to collect fuel. The source of the fire is still the subject of speculation. The victims are said to be mostly those who were fetching the fuel from the leaking tanker, as well as pedestrians and passengers in vehicles held in heavy traffic due to the explosion. Other victims include roadside traders. Sierra Leone's National Disaster Management Agency has been leading the response efforts alongside the Public Health National Emergency Operations Center, which has since been activated to Level 2 to coordinate the public health component of the disaster. Medical and psychosocial support teams have also been instructed to care for the injured, bereaved families, and the affected community. On Tuesday, the remains of over 80 of the victims were buried at an interfaith funeral event presided over by President Julius Maada Bio. A day earlier, in an address to the nation, President Bio declared a 3-day national mourning, in which he promised to set up a presidential task force to ascertain the cause of the incident, to inform decisions to prevent a recurrence. For now, the focus is on providing care for the hospitalized, many of whom are between life and death. And Health Minister Dr. Dembi cannot stress the urgency of this aspect of the response enough.
Three strategy is multi-pronged. The Ministry of Health strategy is first the emergency response. What we do in the first 24, 48, and 72 hours. Now we're in the 48-hour to 72-hour window. We have to do everything we can to be able to save these lives. The next thing we're going to do is over the next 7 days, the first week of illness, is how we stabilize these patients. Um, the difficulty they confront now with regard to pain as a result of the burns is going to shift to ensuring that we limit infection control. So that's going to be very, very critical. And so we have the intense immediate response. We have the 7-day preparation response. We have to look at the 30-day preparation for these people. How do we stabilize them? And as you know, these are burns. It's going to take years and years of care. It may require plastic surgery in a lot of cases. It may require multiple surgeries to manage these patients. So this is a long, long-term